Hello, Whitman-Walker fam. Hope things are good. We're going live. My name is Benjamin Brooks. I use he, him pronouns. And I'm talking today with Corey about cultural competency. Hi. Hi. Thanks for joining. We're going to get started in a few seconds. Hopefully Corey will join me. What's up, Rama? Hi. Hello. Nice. Hello. My name is Benjamin. We're going to get started in a few minutes. Hopefully soon. Just waiting on Corey to join. Thanks for joining us, y'all. My name is Benjamin. I use he, him pronouns. Today we're going to be talking about cultural competency and cultural humility. Whitman-Walker has a brand new resource coming out on Thursday, and it is very exciting. It is a toolkit for cultural competency trainers to understand what is an LGBTQI cultural competency or cultural humility training. I'm excited to share it with y'all starting on Thursday, which is when it drops. I am waiting for my conversation partner to join me. Corey, if you're here, give me a like, give me a love. What do we think? If you have any questions, drop them in the chat. We'll try to answer them later. Gorgeous. So, hope everybody had a good President's Day weekend. We are ramping up for a delightful spring summer here in the Whitman-Walker Institute. It's time to submit our conference proposals. Hopefully we'll be going to many conferences this year. Hopefully, some of them might be virtual, some will be in person. Hello. All right, we have a request. Come on. Glad you're here. Hello.
Hey.
How are you?
I'm good. I'm sorry. I'm a little late. I had actually read the script wrong, and I went on to my own live and start doing the pinning and stuff myself.
That's amazing. I definitely should have communicated that to you better, but I'm so glad you're here. It's so nice to meet you.
It's nice to meet you as well.
So I would love to hear a little bit about you, but I know we've got a script, so I'll let us work through it. But I'm just glad to be joined in conversation with you today. It looks like you brought a lot of followers to our live stream too. Nice.
Yeah. They'll come in and come out. Hopefully we'll reach some souls today. That's the message. That's the motive for me.
Yeah.
Yeah. So I'm Corey. I'm Corey Haskett. Pronouns are he, him, his. I am a social media influencer with Whitman-Walker Health. The topic for today is, I'm sure you've already probably covered that. It's just around cultural competency. A little bit about myself. I have been working in public health for about almost 7 years. A lot of case management and social and economic change, and as well as like outreach. I have done research as well for the community, especially when it comes to HIV and STIs. I actually conducted a condom drop off and testing site in Norfolk, Virginia for high traffic areas, and I also created this program called Blueprint for LGBT sex for our youth, where I used to go to high schools and middle schools and talk about LGBT sex and safe sex practices with LGBT youth as well as allies.
Yes, so cool, Corey. That's amazing work. Wow.
So a lot in the short time period, but it was a lot. Because I kind of jumped into it head on, so it went from 0 to 100 in essence. And that was it. So it's, you know,
Much needed. Were you in the South or in Washington, D.C.?
no, and I was in like Virginia Beach, Virginia area.
Yeah.
I moved here to Washington D.C. in June of 2017. But I already, hey Lisa, I already, and hey everybody else that are coming in. I'm sorry I can't really acknowledge you. Um, all come in, but thank you for for tuning in. Um, but yeah, I moved here to Washington D.C. in 2017. But I had already been in the work. I had started volunteering with an organization called Access AIDS Care in Norfolk, Virginia, at the age of like, I think I was 17 or 18 years old. So, but I landed my first position in the earlier parts of 2017. So that's why I only say around like 6 years of actual work. But I've actually been doing this since I was about 17 or 18. So,
Wow. Well, thank you for bringing all that you have to offer to this movement. Like, obviously, we're just trying to save our own lives, really, in the long run. So I really appreciate you bringing it all the way, all the time. It seems like way to go. I'll tell you a little bit about myself. So I'm Benjamin Brooks. I use he/him pronouns, and I'm the associate director of policy and education at the Whitman-Walker Institute. So that for me, this is my sort of eighth. Oh, am I getting that right? No. This is my sixth year working in this work sort of full time. I graduated from my law school degree in 2016, and I was working doing education and training around HIV prevention and cultural competency and humility for Black, gay, and bisexual, same gender loving men, and then working with community organizations around the country, trying to help them get their HIV prevention programs up and running, and like funded. A lot of it had to do with money. But today, I work for Whitman-Walker, and we try to educate people and share the knowledge and insights that Whitman-Walker has gained through its practice with our community of practice around the country, which is really why we're here today, because we have constructed over the last 4 years, we've been working with organizations around the country to try to understand what is a cultural competency training and a cultural humility training, and how do you know when you've given one, and what are they supposed to do, what are they supposed to sort of bring about in a healthcare organization. So we have a big conversation about that happening this Thursday at 3 p.m., where I have a panel of experts talking about transforming healthcare practice to make it more culturally competent for LGBTQIA people. And if you're interested in registering for that, you can go to any of our social pages and find the registration information. I'm excited to talk about this project because I've been working on it for the last 3 years that I've been working at Whitman-Walker. So, like, ask me any questions that you've got. And please also, you clearly have your own expertise and experience in this course, so like add and you
yeah.
know,
Okay.
we've got some stuff written down, but I know you've got a lot more to say.
So what is cultural competency?
So there's a lot of different ways to answer this question, and cultural competency for me is the process like through which we as medical professionals and people working in healthcare can try to develop the emotional intelligence to recognize and acknowledge and then like set aside your own cultural biases. So you're not really in cultural competency gaining competence in a culture, because like you can't do that in a 2-hour training. You will in a cultural competency and cultural humility training, like learn about other cultures aside from your own. But hopefully what you're supposed to be doing is gaining competency in managing your own heart responses, your like learned and enculturated responses to other cultures. So it's a practice and a skill. I will share, like, I grew up in a very conservative background. I'm from South Georgia. My father was a Southern Baptist minister, and so I've had a lot of cultural competence or cultural incompetency because of the sort of framework that I grew up in sort of shows me that there's only one way to believe in truth, which is not what we want in healthcare, right? And so, what I try to do for my practice of cultural competency is to listen and be curious about other people's lives, right? But like the bare minimum, I think for us, it's for this conversation is like learning to be patient with what's going on in your own mind, to set those thoughts aside and listen to the patient in front of you, so that you can respond to their needs and not just like whatever's going on with the provider that day. Does that make
Yeah.
sense?
Yeah, I completely agree with you. Like just to add on some, so basically, like in layman's terms, for me, like it's like when I think about cultural competency, it's like meeting somewhere exactly, someone exactly where they are to get them to a place where they need to be, and wherever, and whatever way that looks like, because everybody's going to be in a different space when when you initially engage with them. So just engaging with them in a way that is going to actually help the person, um,
Yes.
in a place where there's no judgment. There's a place of no reconciliation. It's just completely just saying, here, this is where you are, and this is where you're trying to get to. So let's get you there, regardless of whatever it takes.
Yes, absolutely. My colleague told me today that it's part of it is like being curious enough to continue to learn about what really stands between people and their healthcare goals, right? Like
Yeah.
I love the way that you put that. That is brilliant.
Yes. Thank you so much. So the next question: What does it matter? Why does it matter in health? Excuse
You're,
me. Why does it matter in healthcare? So why does cultural competency matter in healthcare?
yeah, that's because you cultural competency can be in everything from a legal practice to a restaurant to a building, but it matters in healthcare a lot for us because like it matters anytime you need to trust your provider, right? Cultural competency is and cultural humility is crucial for building trust and open communication between providers and patients and clients. And so that means anything from, especially for like preventive healthcare like vaccines and like taking prep, and then chronic medical conditions like HIV treatment, like gender affirming treatment. All of these things require patients to keep coming back. And if they're not feeling like they are safe and welcomed in your healthcare clinic, they're not going to want to come back and they're not going to get the kind of care that they need. And so cultural competency gives the patient opportunity to access medical care at the same level and at the same quality as like the dominant culture frame does. So it really is about making sure that you are a safe place for every kind of patient that you can have to get care in your clinic.
Yeah, agreed. Like the Whitman-Walker Health page, cultural competency matters in healthcare because you need to build trust. It's about building a working rapport with your client. Like if you come and engage with a client the first time and they feel that you're judging them, or you're feeling that they feel like that you can't relate to them, they feel like that you are looking down upon them, they're never going to want to come back to your healthcare facility ever again, because they feel like that, okay, it's like a teacher and a student type thing, or someone that's belittling them. That's not where as health professionals, that's not our place that we have to be in. We have to be in the place where we're being empathetic and understanding about everything that's going on, and again, getting them from point A to point B in the best way possible. Okay. So for my next question, what is this resource, and who is it for?
Yeah. So we developed with people all over the country, right? We developed an online toolkit to for trainers. This is for people who give cultural competency trainings or who give some kind of training and want to give cultural competency trainings. We um, sort of designed it to provide an explanation about the different parts of a cultural competency training, and then like how it's different from just giving a presentation or having a conversation about cultural competency. It's a training involves more than just talking at somebody, right? It involves two ways of communication. It involves an assessment. It involves presenting facts and information, and then having people use those facts and information and practice using skills. And so we just want to make sure that we create some kind of shared knowledge and standard around what these trainings are, because when done well, we think that it can really improve patient care, and we want to make sure that we know sort of what the high bar is for this standard, because we want to have more high quality trainings out there to change the hearts and minds of people in the medical practice.
Thank you for that. So how was it developed and who was involved?
Yeah. So I've been saying it was developed over the course of 3 or 4 years. The first year it started, we had a summit at Whitman-Walker where we brought in folks from all around the country, sort of started the conversation, started to talk about what it was, and then we workshopped that and brought them back a second year, developed some of the fine-tuning the language. And then the next 2 years we've spent in writing down these resources. We sent it out to over 200 places all around the country and got feedback from 60 people that way. That feedback was rolled in. It's really been a process of building a collaborative consensus from leaders around the country to try to say, we don't have any science around this, but what is the best we can come up with as a group of experts who are thinking about this and working in this every day. So we've got people from Fenway Health in Boston, Callan Lord in New York, Chase Brexton in Baltimore, Howard Brown in Chicago, the LA LGBT Center, of course. We've got people from UCSF, UCLA, all of the people from all over the country coming together, working. All of these people also volunteering, right? This is a real sort of labor of love for a lot of folks.
Thank you for that.
Let's see. I don't see any questions in the chat for us.
Yeah, I don't see any. That's all I was just reading. Yeah, I don't see any questions in the chat for us so far. If anybody did have any questions, you definitely could leave them in the chat, and we can go back later and answer them. And thank you, Ben, for joining us. It was a pleasure. And we have to do the outro now. Would you want to handle that, or you want me to handle
I can handle the outro. Before we go, I want to share a few reminders about the COVID-19 and the vaccines. If you've already gotten vaccinated, congratulations. You've taken a really important step to preventing yourself, your loved one, and your communities from illness. The Delta variant and the Omicron variant are still raging across the United States, and it's totally understandable if you continue to want to keep wearing your mask. The vaccine isn't 100% effective at preventing disease, and more contagious variants are spreading. And so keeping in mind that wearing a mask can be a very helpful preventive protocol. There are very few ways to just tell off the bat if somebody is actually vaccinated, and wearing a mask can be really helpful. So, but if you haven't been vaccinated and you're looking for an appointment, Whitman-Walker Health has the COVID-19 vaccine available. Everyone ages 12 and up are eligible to receive the Pfizer COVID-19 vaccine, and everyone ages 16 and up are eligible to receive a COVID-19 vaccine. Please reach out to us at 202-207-2480 to make an appointment. If you're having trouble making an appointment with us, you can find information on a COVID-19 vaccine walk-up locations in DC at vaccine.dc.gov or by calling 1-855-363-0333. You can keep track of the line at these vaccine clinics by visiting coronavirus.dc.gov/don't wait. For Maryland residents, if you're interested in learning more about Maryland vaccine distribution and to schedule a vaccine appointment, you can visit covidlink.maryland.gov or by calling 855-634-6829. If you live in Prince George's County, visit their vaccine registration portal It says here, but I guess that might be a link there on the script that isn't showing up for us. But if you live in Montgomery County, you can visit there. You can call 240-777-0311 to schedule an appointment. For Virginia residents, you can schedule a vaccine appointment at vaccinate.virginia.gov or by calling 877-829-4682. If you aren't vaccinated and you're not looking for an appointment, please continue to follow CDC guidelines for mask wearing, quarantining, and social distancing, and the like. It's very important that you get the vaccine, discuss COVID precautionary measures with those around you, be mindful of masks and keeping your distance, especially when you don't know whether a person has been vaccinated or not. If you want to support Whitman-Walker, you can register to walk, run, and donate in this year's virtual walk and 5K to end HIV. This will be coming in October. All right. Remember to follow us on Instagram, Facebook, and Twitter at Whitman-Walker, and check our website, whitmanwalker.org, whitman-walker.org, for the most up-to-date information on our services and for more COVID-19 resources and general Whitman-Walker services. You can always call us at 202-797-4439. Follow some of our programs and Whitman-Walker family at RealTalkDC _ and at NoFilterDC and at The Corner DC. And that's it, and the outro.
Thank you so much, everybody, for tuning into the live. It was a pleasure. More things to come, a lot more topics. This is Chunk Papa, social media influencer with Walker's community engagement team. And Mr. Ben, thank you again for tuning in.
Brooks of Whitman-Walker Institute. You can follow me on Instagram at Bleeding Heartthrob. Have a good one.
Have a good one.
Bye.